new analysis out today reveals the shocking number of staff looking to leave the NHS. Well, the figures show that almost half of NHS workers have looked for jobs outside of the service and 29% have actively inquired about non-NHS work.
Now, last year, the Health Service launched its first long-term workforce plan, whatever that means, with a view to retaining current staff and boosting numbers. But stress, workload and staff shortages are the top reasons why workers say they are leaving the service.
Well, Dr Bhasha Mukherjee, a junior doctor for the NHS, joins us now. Good morning. Do the findings from the YouGov survey surprise you?
I'm so sad to say, but not at all. In fact, I remember my first day at work as a junior doctor 4 years ago, pre-pandemic, by the way. And I couldn't sleep that first week because how stressful the job was on the very first day off work and the first week. So, and after the pandemic, it was a whole different situation altogether. I actually was going through therapy and speaking to my therapist about how I've been trying to put money aside to kind of think about how long I can go without having to worry about money if I was to quit the NHS. So this doesn't surprise me whatsoever. And I have many colleagues who are considering and actually actively trying to move to Australia and other parts of the world, New Zealand, to work elsewhere.
OK, Bhasha, really, I saw you yesterday in your scrubs. I walked past you, offered you a biscuit. It's very good to see you in the morning as well. I think what happens in this debate, and I know that you will agree with this, I think that people take up a position. I just want to try and get some common ground, OK? You talk about the stress levels, don't deny that. You talk about the long hours. You talk about how difficult it is for junior doctors. What I want to know is, instead of hearing about people who get trained and then disappear off, how do we, I saw you yesterday talking to Wes, we'll play that in a minute, how do we make our health service more attractive? Because you would understand people will go, they only want more money, they keep going on bleeding strike and we can't see a doctor. What do you want? Do you want better services? Do you want more money? Do you want the NHS to care more about its staff? Roy Lilly, an ex-CEO of a trust, was on earlier saying we need to be thinking about how to retain people, but we need also to use the money more effectively. What's your take on that?
If I had to say something, then I would say that I wish my first experience as a junior doctor wasn't as traumatic. I don't think money is the answer to every problem, because I remember, working and, being told that half an hour to 1 hour after I was supposed to finish work, staying over was just normal and I should just accept it. And it was those little things that added up to having this feeling of, I don't like working here. So any extra support, whether it's having extra staff or even reducing the burden on junior doctors in terms of all the level of admin we have to do, and then on top of that, all the extra exams, all the extra portfolio work, which we all have to do either in our own time or try and slot it into work hours. I think there's an excessive amount of pressure. And I wish some of that red tape was taken away so that we could actually focus on learning to grow within the job field, feel supported, feel, able to voice concerns easily and not, for example, the process of escalating. Sure. If you've stay over at work, it's so long and arduous that
Bhasha,
you just...
Speaking of expressing concerns, you spoke last night on The Sun's Never Mind the Ballots directly to the Shadow Health Secretary, Wes Streeting. Let's take a look at that.
Where's Streeting? We hope not.
Let's take a look at that clip.
Brilliant.
You, as a politician, are not connected in any way to the health sector at all. So how do people, the public and the health sector, how can we trust someone who's completely disconnected with the actual health services, never spent a day in a ward, not had to face the criticism from patients, from social media, the censorship that we get, from GMC and all the rest of it. You don't know what it's like to be in the front lines. Why should we trust someone like you to make the decisions for where we work?
Oh, we don't know what his answer was.
Cut that up.
Bhasha,
anyway, never mind.
Can you remember what his response was, and were you satisfied
what you said is absolutely right, isn't it? And it's interesting for me that Labour put itself in there. They must be seriously believing they've got a chance. Tell me what he said. How did he respond?
He had a very good point that although he's not been in the position of maybe working for the NHS, he has been a patient in the NHS. And, we are a patient centered service after all. So, absolutely, his individual experience as a patient is very much welcome. And, he has shadowed healthcare workers. I'm not sure shadowing necessarily represents the stress levels that you feel when the responsibility.
Let's get back to it, Bhasha, because we could go round in circles. I want you to try and give me a straight answer. I get that it's a patient-centred service. You would acknowledge, would you not, that the health sector, and I said this earlier, right? It's revered, greatest invention. Fact is, it doesn't work. It does work, but it doesn't work. Whether that's staff retention or people being left in corridors, it's still great when you need to go there. But the truth of the matter is, we've got an ageing population, a bigger population. It gets 200 billion quid. And even people like Roy Lilly are saying we should spend the money more effectively. What I want from you is, how would you make the health service financially and service-wise more appropriate in 2024? Briefly, what would you do?
I would definitely use technology to our advantage. I think we really need to push prevention and we need to incentivize good health behavior. I think we have the model in other countries where they rely on insurance policies. And I think we need to encapsulate that and try and incorporate that. So if somebody is quitting smoking or, going to the gym on certain days of the week or eating healthily, I think we should have a point-based system where they're able to use that as a model of, okay, look, I'm doing all these health behaviors. I should be able to access my appointment more quickly. I don't know. We should incentivize good health behaviors.
Do you think the 200 billion quid could be spent more effectively inside the health service?
100%. I think we definitely need to make the systems much better, more efficient. We need to use a centralized system. I really wish that we didn't have to have a different IT system in every new hospital. It wastes so much time for doctors to get used to, and nurses equally to get used to each system, waste days of work trying to get used to a new system and IT. I think if we had a centralized system across the whole country where you could just go to a different hospital and just log on and not have to waste time on learning.
Labour have said that they were going to introduce that. I thought it was really interesting. You must know all about the Red Book. We've both just had babies. And
not together.
Unbelievably, the Red Book system, where you have all the baby's details and immunisation, is a physical book. And if you lose it, that's that. So it would be fantastic.
I like the fact it's a physical book.
Well, Labour are saying that they will bring in an app-based system and digitise more of the NHS.
Carrier pigeons.
Well, thank you. We've run out of time,
thank you.
sadly. Dr. Bhasha Mukherjee, thank you for joining us this morning.